The Veterinary Feed Directive is the tool through which a veterinarian will authorize the use of medically important drugs in or on the feed of food animals. The drugs that require a veterinary feed directive are defined elsewhere. Guidance document 209 is also part of what is driving the drugs that are included. Guidance document 209 states two things. One, for medically important antibiotics, there can be no use of them for growth promotion. The second is that all remaining uses of these medically important antibiotics are to be authorized for feed or water use in food animals by a licensed veterinarian. The actual list of medically important antibiotics lives in another guidance document, number 152 in Appendix A. Appendix A in Guidance 152 lists multiple classes of antibiotics that are used in both human medicine and in veterinary medicine. These antibiotics are either critically important, highly important, or important for treatment of disease in humans. Some of the ones we use in food animals, which you will recognize and are on this list, include the tetracyclines. Chlortetracycline, a common trade name aureomycin, oxytetracycline, a common trade name terramycin. Both of these are available for use in both feed and water, and then the drug tetracycline is available for use in the water. The macrolides is another class, and ones you'll recognize from there that are used in the feed would be tylosin. Also, the other injectables that are in there, you would recognize the trade names Micatril, Draxxin, Zactran, and Zuprevo, which are all used for bovine respiratory disease. It's a big class, a lot of use in food animals. Another class is the aminoglycosides, which includes neomycin and gentamicin. The penicillins, you'll recognize penicillin G and maybe trade name Polyflex for ampicillin. There's a wide list of these drugs that are included in there. Nuflor, fluorphenicol. That drug is a relative to chloramphenicol, which, although it can have some adverse effects in humans, is used occasionally in people. And some other members of that group have fewer bad side effects. That's the broad list of the drugs that are medically important. The ones that are not medically important include the ionophores. Rumensin, trade name for monensin, Catalyst, Bovatec, you'll recognize those trade names also for other ionophores. Bacitracin, trade name BMD in swine. You may recognize Denagard or Mecadox, two trade names if you're working with swine that you'll recognize. All of those are not medically important. So they are not affected by the requirement for a veterinary feed directive. One exception, if a medically important antibiotic is fed in the feed and requires a veterinary feed directive, then the veterinarian must also authorize any drug which is to be fed concurrently. So a common combination in feedlot rations is that of tylosin, trade name Tylan, or generics, and Rumensin, the trade name for monensin. Rumensin alone would not require a veterinary feed directive, but when fed with tylosin, it will need to be authorized for concurrent use on the VFD for tylosin. So that's a quick list of the drugs that are and aren't affected. The quickest way to tell, especially starting January 1, 2017, is to read the label. There will be a statement on the label saying, caution, this drug is limited to use by or on the order of a licensed veterinarian. That type of statement will indicate to you that this drug will require a veterinary feed directive, and you will need to have that from a veterinarian in order to use this drug in the feed.